I welcome each and everyone here. A good afternoon, good evening, and good morning, depending on which part of the world you are joining us from. I welcome each and everyone to this webinar with the theme Strengthening Immunization Supply Chain Management and Preparing for COVID-19 Vaccines. This is prepared in partnership between Empower School of Health, Geneva, and National Pharmacy Council of Rwanda. I welcome each and everyone in your distinguished capacities. In this session, we are going to have presentations, we're going to have a panel discussion, and we're going to have an enjoyable kind of interaction. Please feel free to be open-minded in this discussion and make sure you're getting the best out of this. Without any further ado, I would like to introduce my co-moderator, Mrs. Ropa Hove. Ropa Hove is, yes, we'll be back, Ropa. She's joining, she had lost connection, but I'd like to introduce Ropa Hove as a senior advisor to Empower School of Health and is a pharmaceutical policy and regulatory expert. She is a speaker and a trainer who has held leadership positions at national, regional, national level on procurement, supply chain management, and pharmaceutical regulation. She is the immediate past director of pharmacy services in the Ministry of Health and Childcare in Zimbabwe. Mrs. Hove is a pharmacist with Bachelor's of Pharmacy Honors degree from the University of Zimbabwe, a Master's of Science in Pharmaceutical Services and Medicines Control from University of Bradford, United Kingdom, as well as a postgraduate diploma in Global Health Procurement and Supply Chain Management from the Empower School of Health in India. So I welcome Hove to as well introduce me, and she will continue to take us through the housekeeping announcement and other announcements. You're welcome, Hove.
Thank you very much, Jeff, for the kind introduction. Let me introduce Jeff Boingana, who is a pharmacist and holds a master's degree in global health. He also holds a high-level certificate in leadership management and governance for health system strengthening. He has developed and equipped himself with knowledge in digital health services, health technology, especially in the resource-limited countries. He has special research interests in health economics and recently published a paper on the influence of health technology on principal-agent relationship. He is a natural public speaker dedicated to change the status quo in healthcare and social demographic improvement in general. He is also a consultant in the field of global health delivery.
Thank you very much for that kind introduction, Ropa. And I'll request you to continue and take us through the second agenda item about housekeeping, webinar objectives, and the poll one as we continue. Thank you once again.
Thank you, Jeff. Next slide, please.
Okay.
Now for the housekeeping announcements, I will ask the participants to kindly mute your microphone as well as turn off the video. Please ask questions that you may have using the chat box and raising your hand if you prefer to use that route. We also encourage all the participants to please participate in the poll so that we know more about your interests. Webinar recordings will be available from Empower School of Health on YouTube channels, as well as the slide deck will be shared with all participants. So relax and enjoy the webinar with no need to worry about taking a lot of notes. Kindly provide feedback through the feedback form that will be provided at the end of the webinar so that we can get better in the future. Next slide, please. For the presenters, please turn on your camera for better engagement when you are presenting. And please mute your microphones, those presenters that will not be on the program. You need to mute your microphone so that the other speaker will then be able to participate with no feedback. Please adhere to the webinar scheduled timings. I really beg your indulgence, all the presenters. Now on to the webinar objective. The main objective of the webinar is to understand the importance of supply chain management issues pertaining to immunization with a focus on COVID-19 vaccines. We will now take the first poll, where the poll, I encourage everybody to participate in the poll that is now on your screens. How are we doing for the poll?
Well, as part of my feedback, I see we are doing great. We're having, females are not showing some energy at the moment. They are still very low in polling. Hopefully the number gets there. We have 70 people have polled out of 132.
Oh, that is good progress.
Yeah.
Encouraging all the participants to participate in the poll, please. It is a short poll. Thank you for completing the poll. The results on the gender, there is 78% and 22%, 78% male and 22% females who are present here today. And the age, 27% are less than 30 years, 58% between the ages of 30 and 40, 12% between the ages of 40 and 50, and 3% older than 50 years. On the geographical region, Rwanda has 89% participants. They are none from Southern Africa, Central Africa, 4.1%, West Africa, 4.1%, outside Africa, 2.7%. On the academic background, none from medicine and dentistry, pharmacy, 91.8%, which is the majority, none from nursing, none from other health or life sciences, 1.4% from management, engineering or others, 5.5% from supply chain, 1.4% other disciplines. On the level of education, 78% are from bachelor's degrees, master's 21.9%, and none from PhD level. Where you work, we have 24.5 working in the Ministry of Health or other government bodies, 1.4% from UN organizations, none from donor organizations, 15% from international or national NGOs, 50.7% from the private sector, and 8.2% from other sectors. Thank you very much for participating in the poll. Next slide. Now, just a highlight on Empower. Empower School of Health is a capacity building organization which has presence in over 100 countries across multiple languages, and its thrust is to strengthen institutional and human resources capacity on global health and humanitarian programs through digital learning interventions. So the major focus areas are leadership and change management, digital learning, and public health, procurement and supply chain. The domain areas largely are looking at global health leadership, global health supply chain, i.e. COVID, HIV, TB, malaria, nutrition, MCH. It also looks at medical laboratory diagnostic training, as well as health workforce strengthening, which are nurses, pharmacists, laboratory technicians, and others. And the clients for Empower as you can see from the right side of the screen, are wide, from non-governmental organizations, multilateral organizations, governments, societies, councils, professional councils, donors, you name it. You can have a look and browse through indicated on the left, on the right side of the slide. Next slide. Next slide, please. Empower has global presence throughout the world, and it is headquartered in Switzerland, and its partners, like I've already said, they are governmental bodies, UN agencies, donor agencies, academia, professional associations, you name it, as well as implementing organizations across the world. Next slide. Empower has very skilled advisors and faculty members. The majority of them, I'm sure you would have encountered if you have participated in the courses that are run by Empower. Next slide, please. There are a number of online courses that are run by Empower, ranging from a master's course, which is currently under development in the 24 months, and diploma, postgraduate diplomas, which are 12 months, diplomas, certificates covering the whole area of supply chain management, others with respect to careers in global health and supply chain, as well as storage and distribution of public health products. So they are very broad, and they cover a number of areas that are able to equip the supply chain professionals. Next slide, please. We are now taking the poll number 2. I encourage all participants to fill in the poll. It is only 4 slides. I see participants, some of them are quite quick. They have concluded the poll. Just giving a few minutes to the rest of the participants to complete. It's a very short poll so that we will then be able to understand your level of appreciation of the subject matter today. How are we doing, Jeff, in terms of the level of completeness for the poll?
Yeah, so at the moment, we have 68% of participants have completed the poll.
We'll give participants a few more minutes to complete the poll. We have a lot that we are looking forward to on the agenda today, so urging you to complete the poll as soon as possible so that we will then be able to delve into the business of the day, which we are really looking forward to this launch of the partnership with the NPC. On question 1, on how have you ever dealt with immunization programs before, prior experience? 34% have said yes, 26% occasionally, and 40% never. So you are in the right place today. Number 2, whether you have any training or education related to immunization programs. 33.9% have said none. 59.8% have some training. 6.3% have quite a lot of training. Number 3, on the relevant training and knowledge to handle public health emergencies, 57.5% have said yes, 42.5% no. Number 4, at what level are you working in the organization? 52% are mostly at technical level, 37% mostly managerial, and 11% mostly leadership and governance. Thank you very much. Now I will hand over to Jeff to introduce the next speaker. Over to you, Jeff.
Thank you very much, Ropa, for a good job well done. Within the interest of time, I'll not take any longer. Allow me to introduce our facilitator for the next presentation, Mr. Albert Busumbigabo, who holds a bachelor's degree in pharmacy from the National University of Rwanda and a master's degree in hospital and clinical pharmacy from the University of Liège, Belgium. He has served as the head of pharmacy at the University Teaching Hospital of Butare from 2009 to 2016. Since 2017 up now, he is the director of Allied Health Sciences at the same hospital, and he's a dedicated pharmacist for an optimal healthcare delivery. Mr. Albert, you are welcome.
Thank you so much, Bayingana, for your good presentation. I invite everyone on this webinar to follow the presentation and participate in the questions and the answers, as well as discussions. So I am going to share my presentation. Let me do so. So are you following my presentation, everyone?
Please go ahead. Displaying fine.
Okay, thank you so much. My presentation starts with a small introduction, an outline, which has introduction, and we will see the types of vaccines, immunization, supply chain management. We will see some criteria for effective vaccine management, We will see how we can estimate, but here we will see only the principle and the formula, the 6 right of supply chain, and we will see key indicators for monitoring in vaccine supplies. And then we will look at the case of Rwanda in preparation and supply and of vaccines to the population. And we will see the current updates on COVID-19 vaccines. Next. The expected outcome, I think we will have a share of knowledge on the development process and the history of vaccines. And we will see if for the people who are not familiar with immunization, supply chain management, we will see how we can provide some knowledge, and we will see if this webinar can increase the quality of service delivery. And the last outcome we are expecting from this webinar is the effective quality data monitoring, and which can help in feedback towards COVID-19 vaccination. So when I start with the presentation, a vaccine is a biological preparation that improves immunity to a particular disease. It contains certain agents. Especially a vaccine is either the microbe, which is inactivated or attenuated, or some subunits of that microbe that are used to inject in human body so that it can stimulate the defense of the body and keep the body with a memory when the person attracts the same microbe will have an immediate against the microorganism. So in history, a small history, I think many of us we know Mr. Edward Jenner, who started developing a vaccine against the smallpox in 1796. And thereafter, the French microbiologists Louis Pasteur and Emile Roux have developed the first vaccine against rabies. We are now having this technology because there are some scientists who have managed the effort to develop this knowledge of vaccines. So about the types of vaccines, I've said some words about them. The first group is composed by live attenuated vaccines. This vaccine, like oral polio vaccine, it's a whole microbe that is attenuated and can be used in a vaccine where the person who take this vaccine will he or her body will be in contact with this microbe and develop a defense, and that defense will equip the body with a memory which will be useful when you attract the same microbe in the future. There are other forms of inactivated vaccines. We have many of vaccines which are in this form, inactivated, whole virus or microbe, which is inactivated, which is killed. And then this inactivated vaccine can have the same outcome of keeping the body with that memory against the microbe. So there are some vaccine where they use a subunit of that microbe. Other can use the toxoid of the microbe. We have also a form of conjugate vaccines, DNA or RNA vaccines. Even in this COVID-19, we have many vaccines formed by RNA. We have recombinant vector vaccines. We have quite now many vaccines against COVID-19, which are in the form of recombinant. So the picture below, it's a sort of schematic presentation where when you give to someone a vaccine, there are cells which participate in the sensitization, and then they equip the immunity cells, the B cells, to form the antibodies and cytotoxic cells, which will equip the body with the capacity to produce antibodies or a defense mechanism when the body is in contact with that microbe in future. So now, most of the COVID vaccines we have in the world, most of them are recombinant. We have quite some which are RNA vaccines. Now there are also inactivated vaccines which have been approved by WHO, as well as the vector vaccines which have been approved by WHO. So at the end, we will see the current situation of vaccines in the world. So in immunization supply chain management, the immunization encompasses all the people, activities, infrastructure, resources, and planning necessary to ensure that vaccines stay safe and effective and reach the people who need them. A strong supply chain are a requisite to improve immunization coverage and equity. So this when you have a strong supply chain, you will both minimize the cost of these vaccines, and at the same time, you will effectively reach the whole population and be able to monitor, to conduct a surveillance on the side effects or other consequences related to vaccination, and have the capacity to mitigate them. And they contribute to reduce diseases, morbidity, and mortality. We all know the impact of vaccines when we talk about polio, we talk about tuberculosis. We know the impact of vaccination in our countries in the prevention of these diseases. So in supply chain, the example of my country, where we have manufacturing industries for vaccines, quite many of the countries in the world, they don't have these factories for vaccines. So we order vaccines from manufacturer. They are transported most of the time by flights or boats, and they arrive at the airport or the reception point, and they are put in the central store. Most of the time, you will find that the conditioning in the central store are different from the end point, because in the central store, the vaccines, they are likely to stay there for a long time, while in the end point or health centers, the vaccine you receive are mostly used in a very short time. So even the conditions will be variant in accordance with the time of storage. So they are distributed to district or regional store, then to health center, and they will reach the vaccinator who will vaccinate the mother or the child or the adult for some diseases. And you should every time record what you are doing, which vaccine I am using, which batch number, what is the expiry date, everything for the traceability and surveillance of the vaccines. These records will help in monthly reports and checking if there is something which is wrong or if there is something to improve in the supply chain. You should do analysis, regular analysis, and produce annual statistics and estimates for the next order. Then you will reorder. In principle of supply chain, you should have a lead time when you order. What is the time to receive what have been ordered? You should have all that in mind. What is the transport barriers? What are they? How can I mitigate them? And this will help you to choose which way of transportation when you know the capacity of your stock and you know the strength of your supply chain. And it will minimize also the wastage of over supply or the stock out due to undersupply. So there are 9 criteria for effective vaccine management. Where you find that the first one is about the shipment and arrival of the vaccine. You should plan how you will ship and how you will, when you will receive the vaccines and how to receive them, and then go to the next step, how I will stock the vaccines. The storage temperature is very important. I think everyone knows how we can continue to monitor using the VVM, using the freezer tag, monitor our temperature from the production, from the manufacturer up to the end user, up to the client who will take the vaccine. And you should know your capacity of storage. Of course, when you are ordering, you should know the quantity and the volume. It's very important to know the volume of the vaccine and all the material, the consumables used during vaccination, to know the volume which will be received in your country, in your central store, and what will be remaining in the stock. You should have that calculation so that you will not have excess which cannot be stored and contribute to waste. And you should know, in terms of capacity, you should know the capacity of your storage, your staff, if they are equipped with knowledge to handle vaccines. And you will look at your buildings, equipment, transport. For instance, you will see in Rwanda, we are using all means of transport, including helicopters in the case of COVID-19. You should have an equipped staff with maintenance skills so that if your freezers, your cold rooms are having issues or broken down, you should have a technical staff to solve those issues. You should know the principles of stock management, some very easy principles like first experience, first out. You should have mechanism of distribution. I said that when I was saying that in Rwanda we used sometimes air helicopters. You should know the management of vaccines, the good practice of injections, the doses. Sometimes you find that one vial is having, like this Pfizer vial, is having 6 doses, and never inject. And I've read somewhere where someone have been injected the whole vial, meaning 6 doses, which would be used on 6 people. So you should have all those managerial skills for vaccines. You should have an information systems and supportive management. These are the key criteria for an effective vaccine management. And you should think when you are dealing with supply chain, you should have these rights in mind. Everyone who is working with supply chain should always be reminded about the right product, the right quantity, the right condition, the right price, right moment, and the right cost. Of course, when you are doing a supply chain, you should keep in mind these rights, so that during reception, during storage, during distribution, you should always having this in mind. When I am distributing a vaccine, have we informed the population to come for vaccination? If you are distributing a vaccine which should last not more than 2 days, between 2 to 8 degrees Celsius, you should have mobilized the client to come to take the vaccine. So the vaccine estimation, you start by estimating the vaccine needs, then you order the vaccines, you estimate the storage volume, and you estimate the storage capacity. How much vaccine do I need? If for a given period, at which cost? You should know the costs of your country. So that's why you should balance between overestimation and underestimation. So you should have the real need for your country in accordance with the capacity in terms of finance of your country, and how many. You should know the number of people to be vaccinated. You should know how much are we equipped with the transportation, so that we avoid wastage of resources or having shortage or stock out. In vaccines, shortages or stock out is very fatal, because when you've vaccinated people, for instance, you've given the first dose and you have to give the second dose, and between the time you didn't plan well and you miss the time for the second dose, so you are wasting the resources, because the first dose will not be efficient and you've already purchased it and injected it, and you miss to finish the whole required doses in required time. So this would be a very fatal situation where you are wasting the money and you don't have any outcome. The vaccine need, you should know the target population and doses per target. And the coverage, you should know the coverage you want to reach. If you want to reach 95% or 98%, and then you should think about the wastage rate. Every vaccine have a wastage rate which is acceptable in accordance with its conditioning and its shelf life. So this wastage rate, always should be always calculated and used when you are calculating your needs. So key indicators for monitoring vaccines. You should, one of the indicator is the availability of supplies, the level of stock, and the adequate tools for a safe injection. You should have the required equipment for a safe injection. You should think about bundling. You should monitor this. It's an indicator, a good indicator. The bundling of supplies for distribution. You should monitor the adherence of bundling principles during distribution. You should have all safe injection equipment with all associated supplies. For instance, it's very important to have appropriate syringes when you are injecting the vaccines, appropriate to the volume of vaccine you are injecting. The quality of vaccine storage, you should monitor the temperature, the exposure of vaccines, monitor the VVM. If the color was not changed, you should monitor the effectiveness of utilization of vaccines at service delivery. Of course, when you are dealing with vaccines, you should monitor the whole cycle from manufacturer up to the administration, because any error will make the vaccine ineffective, and then you will not protect the population. So it's very important to know your consumption and always calculate the wastage at service delivery, to know if you are not wasting too much in accordance with the global estimate. So in the case of Rwanda, we started, many people have participated in the planning for COVID-19 vaccines. They developed a budget with all materials, preparation of the population, training of the staff who were used in the vaccination and distribution. And Rwanda have looked into regulatory aspects, if everything is right. They've prioritized seeing which vaccine, first of all, which vaccine to take at which quantity, because at this time we have many manufacturers with different types of vaccines. And what is the target population? First of all, you should think about the frontline people. Like in Rwanda, they started with the people working in healthcare and looking at which coverage, how I will monitor the vaccination, and looking at the service delivery, very important, because most of the vaccines, especially Pfizer-BioNTech vaccine, was somehow difficult for storage in minus 80 degrees Celsius. So you should monitor the service delivery and plan appropriately so that no waste will happen. Monitoring, evaluation, training, and supervision. The supervision were very, and the monitoring were very strengthened in Rwanda. Vaccine and cold chain, logistics, safety and surveillance, demand generation. We should prepare the people to receive those vaccines. And the immunization. In Rwanda, when we received we received the vaccines on March 2021.
We are a little behind schedule, Mr. Albert, if you could try to wind up. Thank you.
Thank you so much. I am staying with a few slides. So when we received these first vaccines, in Rwanda, we used even helicopters so that in 48 hours, we had already started to vaccinate the population. And we were equipped with sufficient storage, especially the refrigerators, ultra-cold refrigerators and fridges for AstraZeneca. And as you can read in the Rwanda outcomes, we find that in previous vaccinations, we've reached more than 95% of coverage of the vaccines used in Rwanda. And for COVID-19, we are targeting to reach 60% by 2022. An update on COVID-19 vaccines, when you go on the World Health Organization website, you will find that there are 237 controlled trials and 92 randomized, non-randomized studies of vaccines already under development. And when you look at the old approved vaccines, these are the vaccines which are already approved. The Pfizer, BioNTech, and AstraZeneca, both from India and England, and you will find other vaccines. Now, there is a vaccine from China and from Russia and from USA and other countries. So this is up to date. I was checking this in the morning. These are the vaccines already approved by WHO. So thank you so much. For the people who want the references, you can find them on my slide. Thank you.
Thank you very much, Mr. Albert Busobigabo. This has been a wonderful presentation, and it can only be depicted through the number of questions that are coming through, either from the chat here or from the Facebook live chat that is happening. And I'll be reading the questions for you very soon on the Q&A session. So just like I said that we are behind a little bit behind schedule, I will just go ahead and request my co-moderator to introduce our next presenter. Thank you.
Thank you very much. Let me introduce the next presenter, who is Professor Andy Barakla. He's the Professor of Public Health and Director of Training at the Empower School of Health. Andy is one of the co-authors of the Yellow Book, the famous Yellow Book, Managing Drug Supplies by MSH and WHO. He has over 25 years of experience working with major international funding institutions and bilateral donors. The main focus of previous experience includes effective management of pharmaceuticals, vaccines, and medical commodities, and especially the implementation of programs for the introduction of new medicines and vaccines for neglected tropical diseases. Over to you, Professor Andy.
Greetings and welcome. I hope we're okay on sound. Yep. Okay, I have only a short time to present a lot of information, so I'm going to speak quickly. You will get the slide deck. All the references are on the slide deck. We've heard about the importance of planning for COVID-19 vaccine. There are major documents available to assist countries. They're on the screen now. Next slide, please. And of course, there are documents specifically for Rwanda about the situation and the overall activities there. Next slide, please. But why do you need all this planning? What's so special about this COVID-19 vaccine? Been doing vaccinations for 30 years. Our EPI program, the extended program of immunization, we've got a 95% success rate in Rwanda. What's so special about COVID-19 vaccine that we have to spend hours in meetings and all this planning and all these documents. Next slide, please. Well, what's so special about the COVID vaccine is the scale of the operations. Very crudely, when you do EPI, the extended program of immunization, the main target is newborns and infants, less than 1 year old. Very crudely, that's around 3.5% of your population. To get herd immunity for COVID, you need to reach 70% of the population. And the target for the first year might realistically be about 30%. That's still 10 times more people than you are doing for the EPI. That's why you need all this planning, all this preparation for COVID vaccine. We're talking about 10 times more people, and that's a huge scale up for any immunization program. Next slide, please. And if you don't prepare, unfortunately, it's far too obvious. If we look at the situation report from 11th of May, 9 countries in Africa have administered less than 25% of the doses they received on COVID vaccine. They haven't even used a quarter of it yet. And 15 countries have used less than half. In Malawi and South Sudan, we've had 70,000 doses expire already. That's what happens when you don't plan and you don't prepare for COVID vaccine rollout. Next slide, please. But why am I telling you this? Rwanda, you just heard, has had a really successful program. They've got the vaccine out there within 48 hours. It was in use. And anyway, what's it got to do with me as a pharmacist? All this planning was done at central level. I'm a hospital pharmacist or a clinic pharmacist or a retail pharmacist. Got nothing to do with me. Well, that's not the situation. Firstly, the situation is dynamic. The planning doesn't stop. There's a major problem around COVID vaccine. Nobody can get enough. And the situation in India now, with India no longer exporting COVID vaccine, especially AstraZeneca, has caused a massive shortage in supply. There are new vaccines. More than 280 vaccine candidates are in development. We've got new WHO approvals of vaccines. Nearly every 2 weeks, they're approving a new vaccine. We've got vaccines coming from China and Russia, which most people don't know much about. There's claims that some countries like the USA and in Europe have got surplus vaccines. What are we going to do if they transfer them? Finally, for pharmacists, who is going to implement the last mile supply chain? It's going to be the hospital and the clinic pharmacists who are involved in implementing the supply chain for those vaccines. So there is a key role for pharmacists. The planning is not finished. There's still lots more to do, and it's important to remain flexible and alert. Next slide, please. But how can you plan anything? And I've just told you, you don't know which vaccine you're going to be getting. You don't know how much you're going to be getting. You don't know when you're going to be getting it. If you don't know what the vaccine is, you don't know what the storage condition is, you don't know how much it's going to cost, how can I plan anything? Well, the old adage, failing to plan is planning to fail. If you don't plan, it's for certain you will fail. Next slide, please. PSM planning is possible. You can prepare all the information needs. You can prepare draft plans and templates and budgets with unit cost estimates. You can start PSM staff training and awareness on the plans. And that means making pharmacists aware of the plans and their role. If you're not fully prepared, you may not receive the vaccine. COVAX may say you're not ready. We're not sending it to you, we'll give it to another country. Next slide, please. There is lots of information to assist you. There is the WHO guidance on COVID vaccine supply and logistics. More is coming all the time from COVAX. There's the UNICEF dashboard on what the situation is on the world for COVID vaccine. Next slide, please. There's lots of detailed documents. What's the specification for a face mask for the vaccinators? They don't teach you that at pharmacy school. You can't write face mask BP or face mask USP. That doesn't work. But the Emergency Global Supply Chain Catalogue has all the information there with the specifications ready for you. That links same reference numbers into the UNICEF supplies catalogue. So all that information, all the specifications for PPE and disposal boxes and goggles and face masks and visors and gloves, it's all there, all ready for you. How many syringes do you need to order per dose of vaccine? Well, all of that is there, calculated in the vaccine deployment costing tool, the CVIC, all there for you. It's 1.05 per injection. There's always a little wastage involved in syringes. Next slide, please. Which vaccines? There are currently 283 vaccines in development. It's down a little bit. In January, there were nearly 300. The list, the link is on the screen. It's updated 2 times a week. Why are there so many COVID vaccines in development? Well, generally speaking, for any vaccine, not just COVID, only about 7% of vaccine candidates make it through to clinical trials. Of those that get to clinical trials, only about 20% get through the clinical trials. You all know about Moderna and Pfizer vaccine. You'd not heard about the other 300 vaccines that went in the bin. They were in development. They didn't get through the early stage development. They didn't get through the clinical trials. Nobody talks about them, but many didn't. Imperial College London didn't get through the trials. The Australian development didn't get through the trials. Many other ones around the world didn't get through. Generally speaking, of all the vaccine candidates, only about 1.5% ever make it to market. So out of the 283 currently in development, we might expect 3 or 4 new vaccines to emerge. Next slide, please. The different vaccines work in different ways. We had a question about vero cells. Vero cells is a type of culture that's used in the whole virus vaccine. It was cultured that way. So basically, we take a inactivated virus, we weaken the vaccine, the virus. That's the same way that is used for polio vaccine. There are other techniques. They're complicated. It needs a separate webinar to explain how all the different types work. Next slide, please. There are 15 vaccines in use around the world already. I've listed out the top 10, which are there. Again, there are another 5 on the use already in the world. Many of you will have heard of the biotech Pfizer, perhaps not so many, the Sinopharm and the Sinovac from China. Next slide, please. How do they compare? The vast majority of vaccines require 2 doses. The exception is the Johnson & Johnson, which is a single-dose vaccine. The prices I'm showing are only indicative prices. They are FOB. The prices change very much depending on the volume you're buying. As you can see, AstraZeneca is by far the cheapest, and that's one reason why that's the bulk of the supply. Moderna is around 10 times the price of AstraZeneca. Okay. Next slide, please. The effectiveness, everyone argues about the COVID vaccine effectiveness. We just compare it first on the left with influenza vaccine. Influenza vaccine is around 60% effective for a particular year. Nearly all the COVID vaccines are above that level. The WHO requirement for a COVID vaccine is above 50%. Anything above 50% will have a major public health impact, and all the currently released COVID vaccines are above that level. Not as good as the German measles and polio vaccine because they've had decades to develop. All the COVID vaccines are new. They'll get better and more effective with time. But right now, they're pretty good as they are. Next slide, please. Word about COVAX. COVAX is the Coalition for Epidemic Preparedness, which helps provide vaccines. It's got two basic mechanisms. It provides free vaccines to low-income countries. It provides a buying mechanism for high and middle-income countries in order to obtain vaccines. So two parts to that. And COVAX aims to provide vaccines for 20% of the population. That's still a big gap, still a lot more needed. How much vaccine are you going to get? Next slide. Yeah, go ahead, please. Okay. Regular updates. Check with the COVAX facility. Right now for Rwanda, if you check down the list of all the different countries under COVAX, you will see AZ, SSI, AstraZeneca from the Serum Institute of India, 996,000 doses, and for the Pfizer Biotech, 102,000 doses. Check regularly, it's updated regularly. Next slide. What's the status in Rwanda? So far, Rwanda has received around 240,000 AstraZeneca, 100,000 Pfizer, a lot more still to come. COVAX aims to do a lot more, but that's off in the future, and it depends on the world vaccine supply. Next slide, please. Where is the vaccine coming from? This is for the AstraZeneca vaccine on the big world map. If you look at the blue, most of Africa was intended to come from India. India has now halted the export of COVID vaccines. So they are replanning what's going to happen. Where is the vaccine made? You can see top right, all around the world, there are different production centers for the vaccine. Who's making the most vaccine? Well, as you would expect, it's China because they have a large population. Next slide, please. What's the storage temperature of the vaccine? They are given in the WHO guidelines for the logistics of COVID vaccine. It's available online, it's free access. Go for it there. And more details are given for the individual vaccines in what are called the job aids. What happens when you open the vaccine multi-dose vial? How long before you can use it? All the details are given there. There should be no problem about knowing the conditions for vaccine storage. Next slide, please. What's the volume? What we call the packed vaccine volume, so we can calculate the storage and transport cubic meter capacity requirements. Again, they are in the WHO logistics manual, all given. It's available online to access. The information is there. It's updated regularly, so you can know for the different vaccines. If you get new vaccines in future, you can check them out on the WHO links. Next slide, please. Vaccine tracking, yes, you need to know where everything is, you need to account for it, and you need to think about the reverse logistics and the waste disposal. I know that's already planned. Rwanda's already got a full environmental management and waste disposal plan in place. But keep that up to date depending on the different vaccines you receive. Next slide, please. Supply chain is still a neglected area. We do need to advocate all the time for supply chain. It's not enough that you know what to do. You have to convince everyone of the need to plan. Make sure the supply chain is strong and operational. Next slide, please. The program is a massive undertaking. If you're going to get to 70% of the population, that's a huge gear up on what's happening. But there are tools and guidelines to assist. The information is fluid, it's changing, different vaccines are coming, different conditions all the time. You need to stay alert and follow what's happening. There is available online, free, a full training course for supply chain for COVID-19 vaccines and commodities. Next slide, please. It's available on the link there. Full course takes you through all the aspects of pandemic planning and supply chain operations for all COVID commodities. It was written for WHO Southeast Asia, but it's got general application to everyone. Okay, that's me finished.
Thank you very much, Andy. That is a lot of time. We now proceed to the next step, next presenters, and I will hand over to my co-moderator, Jeff. Over to you, Jeff.
Thank you very much, Ropa, and thank you very much to Professor Andy. For those of you attending this, for those of you who have taken online courses, especially about supply chain, you must have heard of this voice. And well, if you have heard of this voice like me before in a course, so here is the man. So we're privileged to have that good presentation, and both presentations from Mr. Bell and Professor Andy are a good complementarity. So we are going to proceed to a panel discussion. The presentations have been really good and touching a number of fields. So we are going to combine together the panel discussion and the Q&A. The questions are already in, both from the chat box and from the Facebook live chat. So I'm going to be asking questions here and there to the panelists. And for that matter, for the best of this discussion, we're going to have more people our presenters on the panel. So the panel will be comprised of our previous presenters, Mr. Arbel and Professor Andy, and they will be joined by Mr. Pai Harerimana. I'll be making introduction of our panelists. Pai Harerimana was appointed Chief Executive Officer of Rwanda Medical Supply Limited by the Cabinet in August 2020. He possesses extensive background in health sector through financial and performance audits in sector in Rwanda and Canada. Pai has experience in private sector and number of international donor organizations. He has previously worked for the Office of the Auditor General of Rwanda for over 8 years. He also possesses experience in financial matters after serving University of Rwanda, the former Umutara Polytechnic, as a chief accountant for over 3 years. He is an affiliate of Association of Chartered Certificate Association, the ACCA, a member of Institute of Certified Public Accountants of Rwanda, CPA for Rwanda, and a fellow of Canadian Audit and Accountability Foundation. A bachelor's degree with honors in business and economics. So you are welcome to the panel, Mr. Pai.
Thank you very much.
Thank you. Yeah, I'll proceed to introduce our next panelist, Mr. Shema Ngoga Fabrice, who is a professional pharmacist, sitting also as a deputy chairperson of the board of the National Pharmacy Council of Rwanda. He has also acquired professional experience and expertise in international business from Oklahoma Christian University. He is the owner and CEO of both Africa Medical Supplies Limited and Pharmacie Continentale, operating in Rwanda. He has more than 15 years working experience as a pharmacist. He has benefited a number of trainings in entrepreneurship, pharmaceutical management, family planning, to mention but a few. His pharmaceutical business service as exclusive distributor in Rwanda for various global pharmaceuticals franchises from the US, India, China, Taiwan, and South Africa. Mr. Ngoga has once served as National President of Junior Chamber International, JCI, Rwanda, and President of JCI World, assigned to Africa and the Middle East. You're welcome, Mr. Fabrice.
Thank you so much, moderator, for the introduction.
Thank you. We are also privileged to have Dr. Eric Nyirimigabo. Dr. Eric Nyirimigabo is a PhD holder in physiology and pharmacology from the Chinese Academy of Sciences. He holds a Master's of Philosophy in Drug Analysis for Natural Products from Tianjin University of Traditional Chinese Medicine. He is a registered pharmacist in Rwanda. He is the author of numerous research articles published in international peer-reviewed journals. He is a reviewer and the editorial board member of various research journals. Before further studies, he worked in Nyamata District Hospital as a pharmacist and as an inspector and quality testing of Rwanda Standards Board. He's currently working as a consultant for Rwanda National Communicable Disease Alliance, and and sits as the appointed board member of the newly established Rwanda Medical Supplies Limited Board of Directors. You're welcome, Mr. Eric.
Thank you for having me, Mr. Joffrey. I'm happy to be with you.
Beg your pardon, Dr. Eric. Yes. So once again, as Geoffrey Baingana, I'm profoundly honored and exceedingly humbled to be moderating this panel with interesting gentlemen. And I will start directly with the questions that have come in, and would love to start. And from our audience, you allow me to share these questions, not necessarily to the people who presented, but to all the panelists, depending on their areas of expertise, to make sure we have a proper balance. So I will start directly with Professor Andy. And here came in a question that asked about the health inequity. So I will read directly as it was. You said there was in a presentation that supply chain is a prerequisite, and the question is, and it was directed that strong supply chain is a prerequisite to improve immunization coverage and equity. What would you say on the current inequities of COVID-19 vaccine, and how do you think the situation can be improved considering the strategic supply chain perspective? Professor Andy, you can take on the floor.
Okay, the inequities globally I can talk about. I think Albert probably can talk about more in country than myself. Okay, globally, the problem is that no one is safe until everyone is safe. And that means we have to vaccinate the world. Unfortunately, we are still seeing vaccine nationalism. Countries are hoarding vaccines or keeping them to themselves. They're not distributing them out fairly around the world. We've already seen India stopping export, the European Union stopping export, and the United States stopping export of materials used to make vaccines. So we have to get this message across that no one is safe till everyone is safe, and we have to vaccinate the world. And that's a major struggle to get that message out there. So that's the global inequities. I think perhaps Albert can talk about local and supply chain strengthening as a prerequisite.
Thank you very much. Albert, do you want to add anything to that question?
Yes, I want to add something. In terms of COVID-19 vaccines, in fact, when you cross-check the principles of supply chain, the supply chain that is being used worldwide is against the principles of supply chain. Normally, when you are doing an effective supply chain, you would look at the target population and look at the coverage you want to reach in accordance with the production mechanism in place, and then you put in place distribution so that the distribution should be meet the principle of equity. Now we are looking at inequity distribution of vaccines, which meaning that if we are targeting 2 billion or about 6 billion of people as a target population, and when you want to reach 60% of that population, we would target 4 billion people. So we would look at the distribution of that population in the world so that we put in place the distribution. So to reach that 60% worldwide. So what is contrary to the principles we are discussing here is that USA is producing vaccines, and they are looking at their own population as the only target population in the world, while there are other continents which are lagging behind. So this is normally should not be like that. The manufacturers would have worked with WHO and look at the whole population in global, and then plan distribution equitably, which is not being done. So I can say that there is some kind of selfishness, if I can say, if it's not a very strong word, but it's some kind of selfishness, so that every country is robbing the vaccines contrary to what would be done by the World Health Organization. Thank you.
Thank you very much, Albert. I see we have the most engaged audience, and keep the questions coming. But at this point, allow me to bring onto this discussion our other panelists. And my next question will be addressed to Pai. Mr. Pai, as the CEO of Rwanda Medical Supplies Limited, what are the main challenges the vaccine supply chain are facing nowadays in Rwanda? And what could be the contribution of the private sector to help in handling these issues? Mr. Pai.
Okay, thank you very much, moderator. I may say that in Rwanda, we are having a challenge of, if you look at the setup, everything is in order and everyone is involved, people are sensitized. But the biggest challenge we are facing is to get the vaccine. So that is the first challenge. The other challenge we faced was that categorizing people to receive the vaccine was also another challenge, because you may be working in, let's say, in a health facility, and you get vaccinated, but your whole family is not vaccinated. Sometimes your people may ask why you, not the whole family. The other challenge was that the vaccines we got, I may beg pardon to use it, but there was kind of discrimination, because these little kids, these small boys, girls were not vaccinated. They were not eligible for that vaccination. So that poses a challenge to let's relate it to COVID-19 vaccine. And the other challenge is to get more vaccines. We got few quantities, which are not enough. And if we are to have to order more, we can't order, because if you look at what is happening all over the world, we have a shortage of vaccines. So that is also, that poses a challenge to Rwanda. The other thing is that these vaccines are very, very expensive. So not every country can afford as much as it wants. So this also poses a challenge. So the role of private sector is also to play, the role that the private sector can play in is to make sure that the funds are available. They try to contribute. At least in Rwanda, we have people who are capable of buying, but they cannot, because we don't have that vaccine. If we could have maybe private sector importing, in case they are available, then there are people here in Rwanda who have money, who can afford to pay the vaccine. So I see the role of private sector in contributing to import more, and also support the government in terms of maybe injecting some money in this activity. Thank you very much. Over to you.
Thank you very much, Mr. Pai. And that's very interesting when we are talking about the role of the private sector in engaging into these programs, especially supporting the supply chain system. And at that point, that very point, I would like to bring in Mr. Fabrice Shema, who's been in private sector for quite a while, and he's worked with a wholesale and retail, and he has that knowledge, and also who doubles to be working to be the deputy chairperson of NPC. Mr. Fabrice, I would like to ask to bring this question that came from one of our audience members, and was asking how and what can the council, the National Pharmacy Council and the Rwanda FDA engage pharmacists in private pharmacies so that they can run this vaccination program, knowing that pharmacies are the immediate point of care that is available to the population. Mr. Fabrice.
Sorry, I was muted myself. Can you hear me?
Yes, now I can hear you.
Okay, thank you so much. So it's a very critical questions and important questions, so which we have been through it for the last, let's say, month, whereby we say that the private sector can give a hand to the government so that we can get available vaccines in the country. The issue is not the distribution locally. The issue on the supply chain in this moment is the availability of the vaccines. So I personally and some other colleagues, we try to find ways of getting vaccines, not through the channel of WHO, but through a direct partnership with the manufacturer. So to be honest, it's a very big challenge because countries are on a waiting list. Even though you have money and intend to buy, you will face a challenge of telling you should wait maybe the next 8 to 10 months. So that is the biggest challenge of having it. But today, as I can say, is not the promise, is and the day to come. So we are trying to see how we engage the private sector, not only for the vaccinations. I think we have been seeing, for example, COVID tests running through the private sectors. So now we are in the process to introduce what you call the home test kits. So whereby pharmacies can have access of COVID tests in a single-use pack, and any suspect case in the neighborhood, they can get access of that test through pharmacies. So I think this is the first steps, which we'll see it coming soon, and also will give rooms for further negotiation on vaccination. So I'm very optimistic, and nowadays, as the CEO of Rwanda Medical Supplies have just mentioned, the partnership with the private sector and the government, it's very important to make sure that we are controlling this disease of COVID-19 in our country. Thank you so much.
Thank you, Fabrice. And I like the way you bring it forward, actually. But I would like at this point to bring in Dr. Eric from the academia's point of view. Dr. Eric, looking at the program that is given and looking at the nature of the pharmacists from the program that you are running, especially the perspective of Rwanda, do you think actually when we are asking for pharmacists to run this program, do you think they are equipped with enough knowledge to run this program and make it a success? And under what and up to what extent?
Thank you very much, Mr. Geoffrey. I would say that we are not fully equipped with the supply chain management skills enough to be able to solve the issues that we are raising in this webinar. Because if you get what we have at the university level, we have just a module of a course that is called Logistic and Supply Chain Management, that is studied by a student in level 4 of pharmacy. And then after graduation, there are some pharmacists who are involved in supply chain. For those who are involved in supply chain, they get the chance of getting the admission in the Masters of Supply Chain Management. So, and those pharmacists, they are mostly in the Rwanda Medical Supply. They're working with the Rwanda Medical Supply, apart few of them who are in other organizations and institutions. So seeing the program that they're having at the undergraduate level and postgraduate level, we can see that we only have few pharmacists that are equipped with enough skills in supply chain management. So that's why I would like to even, I'm even happy to see that Empower is coming to give their contribution and in a collaboration and to even increase the number of pharmacists with these skills. Thank you very much.
Thank you, Dr. Eric. And I see many questions coming in, and I'll be reading one by one. But before I continue with the questions, I would like to bring in someone who is raising up her hand. Mama Monique Babuhungu, if you can unmute and give your contribution, then we can proceed.
Can you hear me? Hello, everyone.
Yes, we can hear you. Go ahead. Hello.
Okay, thank you very much for all the presenter, for your good presentation. I have just one concern. We have a good note of having vaccination and all the supply chain ready in place in Rwanda before to receive the COVID-19 vaccination. However, we need to have also the way to report. My question goes to Andy. What do you propose? We are really concerned with, and we want to hear more about it. Thank you very much.
You got breaking, Monique. You got breaking at the end. We didn't get the question very well. Can you repeat?
Okay, my question is about pharmaceuticals. We need also to manage the side effect of this new vaccine. And we have to collect what population is coming up with side effect that they are experiencing. And I want to hear about Professor Andy, what is going on elsewhere in the West, so that we can align ourselves on it.
Thank you very much. Thank you very much, Monique. Professor Andy, you want to answer that question directly about the pharmacovigilance part of the vaccine?
Yes, of course. I'm not based in the West. I'm based in a low middle income country. So, but okay, I can tell you what is happening. Okay, so pharmacovigilance, most countries have a full reporting system. It varies slightly according to the vaccine type. But first, let's understand that all the COVID vaccines so far are intramuscular injections. That's a little bit different from some of our other vaccines because they are often intradermal or subdermal injections. So that's already a bit of a change. Whilst it's very common to administer intramuscular treatments, it's less common on the vaccines. So there have been problems around the needle size. For large body mass people, it means in order to get into the muscle in the arm, you need a longer needle than a standard vaccination needle. So that's been one of the major reporting aspects. For people who are above 100 kilos, they are suggesting look at longer needles. But overall, there's been a variety of effects. You've heard lots of publicity, but there have been very, very low reports of major problems. So I think we do need a full reporting system. It does need to be followed up. They are available. Recommendations and guidelines for the reporting are on the WHO websites, all there to follow the system through. If you want more specific information, I'll continue, but I'm aware of the time, so to give others a chance to answer questions, I'll happily do that. But so far on all the vaccines, what we've seen is sporadic, low incidences of problems.
Thank you very much. Professor Andy. And I've had many people bring in different suggestions, and I would like to take a step and really read some of the suggestions that people brought in, and some were like this came from Dieudonné. He said, supply chain wise, 5 errors are nowadays replaced by 7 errors to accommodate right product in the right quantity and quality at the right place in the right time to the right customer. In this context, that's the right patient. Allow me to ask this question. I think it's a little bit sensitive, and Albert, you'll help us handle this. Someone asked this, it's really a short question, but very interesting. What happens when someone misses the next dose of the vaccine? As simple as that, in simple words.
Thank you so much, Geoffrey. I think in terms of vaccines, Dieudonné is right. There is another right of the right customer or right patient that should be included. But in some literature review and some supply chain principles, when you are planning the needs, you should have the target population. So that target population you are quantifying for is that right population you want to cover. In accordance with when you miss the vaccine, we all know that when you have it depends on which kind of vaccine. First of all, there are some vaccine which we require only one injection. Some others you should inject 2 times, and other vaccines you should inject more than 2 times. So it depends on the type of vaccine and the response of the human body. So when you inject a vaccine in human body, there is that creation of memory or creation of antibodies. So the antibodies should reach a certain level. Normally it is required after every vaccination. When you complete the course of vaccination, you should go to lab to give the sample, and they do the testing of the response or the antibodies you've generated after the course of vaccination, and they look if you've reached the required level to prevent you from the disease. So when you receive the first jab, it means you stimulate the formation of the production of antibodies, but you don't reach the required level for not getting the disease or being able to defend yourself against the disease. So when you repeat the jab in the required time, it means you are boosting the first dose, and then you increase the number of antibodies, then you reach the required level of antibodies required to protect you. So when you miss the second dose, it means you will still have a few antibodies, not enough to protect you, and the memory created, the memory to remind the body about that microorganism will be short in time, and then you will not be protected. That's why when you don't respect the timing of injecting the jabs, it's better that when you've lapsed for a long time, it's better that first of all you do doses of the first antibodies, or simply you repeat the course of vaccination. Thank you.
Thank you very much, Arbel. And dear audience, you'll allow me if I skip a number of questions that I think moderators, panelists have already talked about. For example, the questions I was asking Fabrice, how how do you see pharmacists' immunization procedure in Rwanda? I think he's already talked about this being a work in progress. So allow me to ask this other sensitive question to Mr. Pai. The question came in from the audience and says, are we still relying on COVAX to get vaccines, or the government through Rwanda FDA has to expand to other available vaccines by first assessing them for emergency use authorization? Mr. Pai.
Thank you very much. Saying that you cannot rely on COVAX is I may say that it's not true. Of course, if we manage to get some vaccines through COVAX, that will be good. But our country has also been trying to get as much as possible vaccines that are needed in the country, whether using its resources, using other possible means. So COVAX, yes, but if we don't also succeed with COVAX, we can still manage to get some using our resources to have in the country. So we cannot rely on it 100%, but if we manage to get it, it will be good. But if we don't also, we are trying as much as possible to make sure that there is some resources. We have some resources allocated to the vaccines, and I'm sure it is working well. Thank you.
Yeah, thank you very much. I still have many questions that are directly related to the presentations that were made, and I'll be asking them the presenters. But allow me to first ask this challenging question to my good friend, Mr. Fabrice. So the question came in here and is asking, do you think Africa, especially Rwanda, is able to produce its own vaccine? And you can take it together with what can be done in order to have our own COVID vaccine as pharmacists, like bring up together our efforts and come with a vaccine. You can take that up, Mr. Fabrice.
Yes, I think that Rwanda, it's something we dream for, and the good of this and the beauty of this is that we have leadership who believe that we can do it. So if leadership believe we can do it, that means we can allocate all means of having a vaccine production. Nowadays, it's very easy. I think if you followed recently one biggest announcement, this is the first time I think during this century that the US has amended a law to don't give a patent for all these vaccines manufactured. So that means if you have, for example, a good partnership with Pfizer or AstraZeneca or Moderna, you can produce your own vaccine under a simple agreement of manufacturing, which before, when you compare with others, new generation or new technology, new products or new molecule you can find in the market, you have to have at least a minimum of 10 years of patent. So the good things of waiving the patent for the vaccine worldwide and giving an opportunity to any country which can present or give the possibility of investing in a vaccine, I can say with high confidence, yes, Rwanda, we can produce a vaccine. It's not to reinvent the rules, so it's there is protocol which we can follow easily. So I'm very confident that we can do as Rwanda. Thank you.
Thank you very much. Yeah, thank you very much. Time is not on our side. The organizers of this, both NPC and Empower School of Health, are going to see how they can organize the next set of questions that have not been answered, but I think all the questions are good and interesting. Allow me to ask one final question that came in earlier and was directed to Professor Andy. The vaccination is failing in some countries based on the matter of immunization supply chain infrastructure, that being the core issue. is there any clear ongoing project to handle this issue? Like talk about countries that got issues with expiries and so on and so forth. Professor Andy.
Yes, there is. The Gavi program already provides major technical assistance to a number of countries for vaccination programs in general, and specifically, it has received additional funding to provide assistance for COVID-19. So there is assistance there. It's certainly not enough, but it is present. It does happen. But there is a major problem on vaccines and on the whole supply chain that needs to operate just because of the sheer scale. And I think the scale of that operation is still not yet fully recognized. We're looking at least 10 times more than EPI has been doing. That's the kind of infrastructure development, and that's serious long-term funding. But there is support from Gavi on technical assistance and infrastructure strengthening, and through Global Fund. It is possible as well.
Thank you very much, Professor Andy. My time is up. Allow me to steal in 2 minutes and ask one question that is going to Dr. Eric. This is a follow-up question from your presentation, came from your submission, and comes from the audience, and they're saying, do you think there is a need or there is any collaboration between the regular and the regulators and academia to authorize the training curriculum for pharmacy professionals so that it fits the contemporary pharmacy practice? You know, this is emanating from what you just said, that the training is not as sufficient as needed. Dr. Eric?
Yeah, thank you very much, Geoffrey. There is a collaboration between the council and the university in terms of capacity building. And the good thing is that our program, the curriculum that you have at the university level, are not static. We have a certain period where we sit and review the programs for our students. And I think as the needs rises, then we will try to review the program and incorporate the supply chain management in our curriculum. Thank you.
Thank you very much, Dr. Eric, for that. So one wrap-up question is addressed to Mr. Fabrice. Tell us about the partnership as the deputy chair of NPC, the partnership between Empower School of Health. How is this going to be important for us, and how is this going to be improving capacity of a pharmacist in Rwanda?
Thank you so much, Geoffrey. What I think I have to inform my fellow pharmacists is that we have done for the first time a good partnership which can benefit both our organization, the National Pharmacy Council and Empower. We know that our pharmacies sometimes lack continuous way of improving where they are in a field of work. It will be in a private sector or a government. We have some gap to put this continuous way of learning in place. Today, we are talking quite of the biggest challenges related to the global health procurement, related to the supply chain. And what we think, we believe, we should benefit from this partnership with Empower, which has been signed last year, because we started discussion since October, last September, and then we signed an MOU, an agreement for partnership in December. So this is our first webinar.
Sorry, I think Fabrice got breaking. Sorry, I think Fabrice got breaking, but the key is this is very important, and he said it's going to be a series of webinars that we will be co-organized between National Pharmacy Council and Empower School of Health. So within the interest of time, I'll hand over back to Ropa, my co-moderator, to take us through the next final wrap-up on the agenda. Ropa?
Well done, Jeff. Well done. As we approach the end of our very fruitful engagement this afternoon, we will now carry out poll 3. And as the poll is being uploaded, let me congratulate and thank the National Pharmacy Council of Rwanda and Empower School of Health for the successful launch of a robust partnership through this very rich webinar, relevant for such a time as this. Thank you so much to the speakers, to the panelists, all the participants from government and private sectors, the teams behind the scenes at both NPS and Empower. I can take successful launch. Last but not least, the moderators for navigating the program. The poll has been uploaded. Please complete the poll, and the certificates of attendance will be available after this webinar. You can download your respective certificate from the chat box. The link will be provided in the chat box. My co-moderator, Jeff, any final remarks, any final words?
Thank you very much, Ropa. This has been really engaging and fruitful. I am so much indebted to the audience for your good questions. I know some questions were not answered, but just like you had, the presentation is going to be shared, and you can reach out to all the presenters either on their different platforms, could be their emails, could be their social media platforms. Let's engage them as much as we can. But as you heard, there's going to be other webinars to come. We could still have our questions presented to them and they answer. So I thank you very much. I thank you, the panelists, for good submissions. Spot on, and you helped me as someone who moderated this panel to keep within the time frame. Thank you very much once again, and thanks a lot to my co-moderator, Ropa, for being a wonderful co-moderator for today. Thank you.
Thank you, Jeff. You have done marvelously. So the poll is in progress. Can I just seek the indulgence of the participants to complete this last poll? How are we doing, Jeff, in terms of the level of completeness?
The level of completeness is still very low. I would ask people to, yes, to put this very fast. We're still at less than 10%, but the polls are coming in. Please don't leave before you can complete this, and as soon as the poll is done, you'll get the link to download your certificate. Please, once again, this event is CPD accredited, and that would mean you present your certificate to have your CPD credits from the responsible organ in your country. So please make sure you finish the poll, then make sure before you leave, you also download your certificate. So we are now hiking, we are now at 8%. 9% and 10% and counting.
Thank you very much. I have noted feedback from one participant to say that it would be better for the certificate to be sent on email. I would urge that you attempt to download. If you are not able to download, certainly Empower will then be able to send to you on email. But once the link is there, it is not onerous to download the certificate.
So my Ropa, if as we're concluding, we got the vice chair, the deputy chair of NPC breaking, and he's back on the call. If he could conclude his remarks, I think there were some important points he was yet to make.
Very much so.
Yeah.
Very much so.
Yeah.
Let me just go through the poll results and certainly hand over for the final remarks that we could not receive. So on question 1, have you been involved in any immunization campaign? Yes, quite a lot, 13.7%, okay, 3.5%. Are you participating in the COVID response? Participating quite a lot, 45%, they have never participated. Question 3, has the COVID vaccine been introduced in your country? To Rwanda. How did you find this webinar? Very useful from 81.7%, useful from 17.6%, needing improvement from 0.8%. There is always room for improvement. Thank you very much. So over to you, Jeff, for the remarks from the Vice Chair.
Thank you very much. So, Mr. Fabrice, if you're back, then you can conclude your remarks for this event.
Geoffrey, can you read the remarks? Because he said that he is disconnected, but he left the message in the chat box. Sorry. Oh, he's back. He's back. He's back.
Mr. Fabrice, we are giving you more time to conclude on your remarks. We had seen the message in the chat box.
Maybe he's muted.
Mr. Fabrice, if you are speaking, you are on mute. Eric, can you read his message? So that we conclude this.
Can you hear me now?
Yes, yes. Now you're loud and clear.
I don't know what happened to this. Okay, I'm very sorry for this technology, but what I want to say that in the next 30 seconds is just to thank all participants for this big turnaround and launching the partnership with NPC, with Empower. I was saying that we've been able to sign an MOU and an agreement with NPC for a mutual benefit for our members, which we wish that learning is very important, and knowledge. By the time we are all in a working place, it's very important to keep ourselves informed with different and various aspects. But the good things I can say, for the first time, we'll be having courses which can last for a month, depending on the topics of the month. We can ask pharmacists to enroll. It will be just a very short courses where we'll have to dedicate maybe 2 hours per week. But also we'll enroll for the first time an online postgraduate diploma I think we are trying to find a way with University of Rwanda how we can push pharmacists to engage more into learning and have an ability to get a postgraduate diploma in a global health management and a procurement and supply chain management. So I thank you so much. I thank the participants. I thank the organizers, the team from Empower, the moderators, the co-hosts who are the panelists. Thank you so much for giving us this time, and it was very fruitful, and we hope that next time we'll call you again, and please try to join and celebrate this great partnership with Empower. Thank you so much. God bless you.
Thank you.
Thank you so much.
Yeah, thank you very much. Was a suggestion if we could have someone giving us like a concluding remark from the side of Empower School of Health. I was about to call on Professor Andy for just waving remarks.
Okay, sorry, just while I get on to unmute. Okay, well, our thanks to all for attending today. I bid you now, as I always do, to go in peace, light, and tranquility, arrive home in joy and happiness. As we think about our role in the experience of COVID vaccination, think what we can contribute, what we can do, because together, I believe we can overcome this disease and make the world a better place. Namaste. I bless you all and wish you all a good night.
Thank you very much. That's my last word.
Indeed, it's the last word. Yes, I also saw the feedback from the chat box. You are right. It is the form that will enable you to put down your email addresses so that the certificate will be sent to the email address. So it's a very short form to complete your name and your email address and the organization, and then you submit. That way, automatically the certificate will be sent.
Thank you all and have a nice evening.
Thank you so much all and have a nice evening.
Yeah, good night to all.
Thank you very much. You too have a pleasant evening.
Thank you, everyone, and have a nice evening.
Thank you so much. Thank you for your time as well.
Thank you and bye-bye.